Hey everyone, Dr. Ritza here, downtown Toronto chiropractor, acupuncture provider, and manual therapist. And what this video is going to be about is a side bridge progression. So in our other videos, we've gone over the abdominal bracing and how to properly side bridge. And this is the exercise that I give to my patients when we want to take it to the next level. Fantastic exercise for people that have suffered from chronic low back pain, from people who have hip conditions such as iliotibial band syndrome, patellofemoral pain syndrome, or other such activities that I might give to some hip and knee injuries. So for this exercise, what we're going to need is a theraband, and we're going to start off with our regular side bridge and progress it to make it much more difficult. With this, what I generally do is actually just use isometric holds, where you hold the same position, slowly progressing up to 1 minute. So sometimes with patients, we give it to them and they initially can only do the holds for 15 seconds. That's a-okay. You work on it a little bit every day, slightly, or work on holding it longer and longer, and in no time you're up towards that minute. So what we do is we take our theraband, which is looped and tied at one end, we wrap it around the thighs, just below the knees. And so with this, we're gonna do a regular side bridge, work on holding it for a minute, and we're going to add in a clam-shell and a leg extension while we do the side bridge. So just as a refresher, we get into our side bridge position just on the knees, ear to knee are lined up nicely in line, and we would hold this working for 1 minute. Next, after we've taken a small little break, we come back up into side bridge and we're going to add in a clam-shell. So the clam-shell is when the feet stay together and the knees separate against our resistance band. We want to make sure that we're maintaining that good glute activation and also good activation in the core. And again, we'll progress to holding this for 1 minute. Do it on both sides. Take a break. The next exercise that we're going to do is the side bridge. We're going to add in a hip extension and leg abduction. So the leg comes straight out and up. And what we'll do, and what you'll see from the side profile, is I'm mainly just activating the glute mid and glute med, and I know I'm doing that because the leg is slightly behind the midline of the body. We maintain that good core activation and glute activation, and work on holding that for 1 minute. So here's our side profile for our side bridge progression that we've been working on, guys. You can see that nice alignment, just like the other side bridge video, from the ear, the shoulder, the hip, and the knee, nicely aligned. You can see the pelvis is not sitting back, which means that the glutes are not activated. They're nice and tight, holding that coin between the buttock muscle, which is our Q, and then also maintaining that nice core activation on the side. And then when we go on to do either the clam-shell, where my left knee is raising off my right, I don't change my body position at all. And the same thing when we go to do that leg extension. This is the one thing I really wanted to highlight, where the leg is not in front of the body, which would activate more of the TFL, but rather out and towards the back, where we know that gluteus minimus and gluteus medius are working really hard to hold that up, which is quite strenuous.